All right, we are finally at the end of our circulatory system lectures. Now, we are going to talk about how the blood gets through the pelvic region, down to the legs, and back to the main body. All right, so what happens at right about where L4, L5 is that the aorta splits into two common iliac arteries. Remember, common means it's going to split into two other things. So we have a right and a left common iliac artery. Those split into internal and external iliac arteries. So these two are the internal iliac arteries. These two are the external iliac arteries. The external provides some blood flow to structures, I can talk, of the lower abdominal and pelvic region. Internal iliac arteries provide most of the blood flow to the structures in the pelvic region. Once the arteries have gone past the inguinal ligament, which remember is this thing right here, then they become the femoral arteries. So again, we have a right and left femoral artery. And the femoral artery is then going to travel down along the femur to provide blood flow to the leg. The blood flow to the pelvis, like I said, and to the structures of the perineum, that's the bottom of the pelvis, branches off of this internal iliac artery. Okay, so here's the common iliac. This, of course, is the ilium. The iliac is named because it travels next to the ilium. Here's the sacrum. The internal iliac artery is then going to make a bunch of branches that flow throughout this gluteal region, the medial thigh muscles, the lower rectum, the anus, the uterus, the vagina, all of those things. The external iliac is going to become the femoral artery and pass down along the femur. And it's going to supply blood to the hip, to most of the muscles of the legs. There's this circumflex artery that goes around the femur. And then in the popliteal area, it's going to become the popliteal artery. And then that's going to supply the knee joint. And then it's going to travel down and branch into a tibial and fibular arteries. We're not going to worry about that. We're going to worry about the veins coming back, which fortunately for us aren't all have the same names as the arteries. Oh my gosh, they run in parallel. They all have the same names. How much easier is this? So the femoral veins, right and left, become the left external iliac veins after passing below the inguinal ligaments. The left and right external iliac veins then fuse with the right and left internal iliac veins to create common iliac veins. Again, left and right common iliac veins. And then the fusion of the left and right common iliac veins creates the inferior vena cava. And the inferior vena cava then travels up through first the abdominal cavity and the thoracic cavity, and eventually dumps the deoxygenated blood into the heart. Yay. And that's all we need. All right, we're finally done.